Good morning, good afternoon, good evening, colleagues. Welcome to this ICN-hosted COVID webinar. I'm not going to say that again. I'm going to say that just once. It is unprecedented and extraordinary times that we find ourselves in, and all of you, we as a profession, are right at the very center. So I firstly just wanted to thank everybody for finding the time to be with us today. We know that all of you, not just our panelists, all of you who are joining us are involved, connected, working incredibly hard in your country responses to coronavirus. Since the beginning of the year, colleagues, the ICN president, Annette, and I have been in very close contact with all of our associations who have been dealing with the coronavirus response. We have put the response absolutely at the center of our work and have followed this from the beginning of the year very much with our associations as it's spread to different hot spots. And what has been very, very clear to us is that there is not only incredible work that's being done, but immense leadership, learning, and good practice as well, that nurses, nursing organizations, and our associations are central to. And the purpose of this morning's, the two webinars that we have today, is very much to start to be able to share that learning and experience. This morning, this evening, wherever you happen to join us, I am particularly grateful that the leadership from the Taiwanese Nurses Association, the Chinese Nursing Association, and the Korean Nurses Association are here with us and are going to share their experiences. This is a global crisis and it requires a global response, and for that reason, as you'd expect, we have also been working very closely with a number of colleagues at the World Health Organization. We know how busy they are, and we thank all of them, and particularly Elizabeth, to give us your time for both of these webinars. I know that we at ICN and everybody on this this webinar will hugely appreciate that. So colleagues, I'm now going to hand over to the ICN President, Annette Kennedy, to say a few words. Annette is online and she can hear you, but we've had a problem with her camera this morning, so she's not hiding from, she's not deliberately hiding from you. But Annette, let me pass over to you now.
Okay, thanks, Howard. And hello, everybody. I'm sorry that you cannot see me. I think it's trying to tell me something. Maybe I shouldn't be visual at this moment in time. Maybe that's, you know, this has been causing me a problem, the camera. But I'm delighted to have you all here. This is about sharing, it's about learning, it's about uniting. And I suppose in the words of Dr. Tedros, his call yesterday is fight, unite, and ignite. And that's what we have to do. We're very proud of what nurses and the Nurses Association have been doing over the last few months. When we started out with being so excited last year in May, when the World Health Organization designated 2020 as the year of the nurse and the midwife, we never thought that this is where we would be. We had envisioned a very different year. We had planned for a very different year, but this is where we are. And this is a test of all our capabilities. It's a test on the world, and it's a world that we will see very differently in the future. I think it's shown nurses and the Nurses Association at their very best. Our aim is always to support our nurses associations, to support our nurses, to protect them, and in that way to save lives. So as Howard has said, we've been working very closely with WHO, and I thank our colleagues for being here and being with us today, and also our national associations who are going to present later. And just I will go through some of the lessons that we have learned, because our first people to experience this, and particularly China, was the first country to contact us. And they contacted us very early in January to tell us that they were short of protective clothing, and that they needed support, and that they needed support for their nurses. They were overwhelmed. And what they have done is, I suppose, given other countries some time to prepare. And they have shared a lot of information about their experience. They have drawn up a lot of policy documents. They have given us a video, and they have done a lot of work in this respect. And we acknowledge the work that Dr. Wu, the president of the Chinese Nurses Association, has done to support our people, and particularly working with government and being constantly on the media and giving information and disseminating information to her nurses. And then she will share with you her experience. We have learned a lot from it, and we have been sharing it through updates, sharing it through our social media, sharing it with Dr. Tedros and WHO, and highlighting it for governments. And this has been very helpful. In South Korea, and with our nurses in the South Korean Association, the Korean Nurses Association, and the Taiwanese Nurses Association, we have learned a lot too. Their experiences have been different. As you know, the Korean Nurses Association have been trying to flatten the curve. We hear about the curve all the time, and not having a curve in our numbers coming through health systems that are not prepared for it. And it's all about flattening the curve and finding out as quickly as possible the people that are infected. And you have heard Dr. Tedros on many, many occasions saying test, 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 test. And now they are saying across the world that, of course, we have an awful lot of people that are asymptomatic, and that possibly have been around in countries for quite a long time before it was actually brought to the fore in country. The South Korean Nurses Association, of course, have been going out to their areas, and they have been sitting at the top policy tables trying to shape the strategic plan for the way that the health service is delivering and supporting this pandemic. The Taiwanese Nurses Association, of course, have learned very quickly from the SARS virus, and they have put in a lot of support structures and a lot of different various areas of actually preparing for any other pandemic that might come the way. But you will hear more from them later. All of the countries have been very good and have shared videos with us, have shared information with us. And that information we have tried to disseminate to other countries in order to prepare them. We've also done an awful lot in relation to press releases, in relation to lobbying governments, in relation to sending letters to our associations of support. We're, of course, very upset that so many nurses in Italy and in Iran and in Spain and in other countries have succumbed with their lives. And that is very upsetting for us, because the last thing we want to do is to see our colleagues and our nurses die in the face of a pandemic. So we have to do everything we can in order to protect our nurses and in turn protect our patients. These are pictures from all over the countries of nurses, and you yourself have seen on, I'm sure, TV and on video and everywhere, the exhausted nurses the nurses that are working long hours, the nurses that are working with protective clothing, that is so difficult, not just to put on, but so difficult to wear. And we have never experienced this kind of, I suppose, work for nurses. It is extremely difficult. There are so many pictures of these doing all sorts of very difficult jobs, and without the appropriate resources. I'm very encouraged by the way that nurses are stepping up and answering the call for help. We have seen countries asking for nurses to come on board from retirement from other countries, and even in my own country we have seen 50 or 60,000 responses. We've seen doctors and nurses coming in from all over the world to help their own country, because we put out a call on St. Patrick's Day. So this is what we see right across the world. Nurses are supporting each other, they're coming to help each other. And although it's the year of the nurse in a very different year, I'm very proud of the way that nurses have stepped up to the plate, stepped to the call, and their associations are helping them. Strong associations make strong health service, there's no doubt about that. And we go back to Florence Nightingale, and of course 100 years ago, Florence Nightingale talked to us about health promotion, disease prevention, and infection control. And we're back to that again today. And I hope that in the future that the world and the health systems will see that the most important thing is in public health and community care, and that's where nurses make the biggest difference. So we have been striving to support the National Nurses Association, coordinating information, sending out letters of support, and we have been sharing that information both on our website, through Twitter, through social media, Facebook. We have been issuing press releases on a regular basis. We are working with WHO and the NNAs and our NNAs on technical guidance and good practice. We're advocating constantly for health workers' rights and for the distribution and having sufficient protective equipment. And we know that every country is short, but every country is taken from the same supply areas. And what I would like to encourage is that everybody would encourage their governments to start producing their own supplies, because we will end up with countries that are in low and middle income not having any protective clothing at all. And we've just heard from Zimbabwe that they went on strike, nurses and medical staff went on strike because they have little or no protective clothing. So that's something to keep in mind, because some of the low income countries are going to be very badly stuck if we're all taken from the same source of supply. We've been informing public health policy, we've been informing governments, we have been doing everything in our power, because this is a very different situation for us. And what we'd like to hear from you is, what would you like us best to do for you? Because we're here, we're willing to do what you would like us to do, what would make the most difference to you in relation to supporting you through this time. We will get through it. I have no doubt in my mind we will get through it. We will be the better off. We will lose a lot of lives, and I'm so sorry to know that a lot of our people, particularly our older people, will die as a result of COVID-19. But hopefully there will be some learning at the end of it, and that there will be some recognition that no health service can survive without nurses, or putting them to the front. I think there's just another slide in relation to where we have been advocating for useful information in relation to guidance documents. See, there is so much information coming out of WHO and updated on a regular basis. These are some of the technical guidance documents. I'm not going to go through them all. You've heard a lot about infection control and prevention. You've heard a lot about the need to test, who to test. Countries are doing things differently in the way they're testing and whether they have enough testing kits. It's all about preparedness. Critical preparedness is the name of the game. And although this guidance is coming out from WHO, every country is issuing their own policies and their own guidance, and we have to be mindful of all of that. We also have been on the media on a regular basis. I think you can push on the slide. Howard, just this week on Tuesday, was on World BBC. Sorry, this is I thought we were on a different slide, but anyway, this is where we have sent messages of support to China and to elsewhere. And these have been well received, because the countries in the greatest trouble and the ones that started out with the first information about the pandemics have been coming to us for support. And the one thing that we could do is issue letters of support to our associations that are going through the worst of the pandemic right now. And we have done that on a regular basis. We have tried to, insofar as we can, talk about the need for psychological and physical support that nurses need, because we know this is having a disastrous effect on all healthcare workers. We also need them to be tested, and we also need to ensure that they are supported. We've seen pictures of nurses, and particularly I'm conscious of the ones we've seen in Italy, lying across desks, sitting in corridors, exhausted, absolutely exhausted. So what we want to do is for both us and for the associations to support our nurses on the front line as much as possible. The next slide is, I think, in relation to, yes. We have used the media as much as we possibly can. Sky News, Reuters, Euronews, BBC, CNN. And I would suggest that you look at the last World BBC News that Howard did, actually pushing for countries to have sufficient protective equipment. And you know, it is an extremely good interview, and I would suggest you watch it. But we have been doing the best we can in order to bring the information, the concerns of all our members to the media and to the World Health Organization and to governments. I think that at this stage, I might hand over to you, Howard.
Thank you very much, Annette, for a very comprehensive run-through of the work that we have been doing in collaboration with partners and with our associations. As Annette has said, our work has fallen into broadly three areas: issues around guidance, practice, technical issues, work in relation to health worker and nurses protection, and then of course the big health policy responses as well. Annette and I both had the opportunity to talk to Dr. Tedros right back at the beginning of the year about the supply of PPE, and the President spoke to him again just very recently. It's been at the front and center of our work for all the reasons that the President has said. We are very concerned that the figures that we had from Italy of a 9% health worker infection rate last week were worryingly high. That's gone up and is higher now in Spain. We think that there's a significant probability that that rate will be even higher, dependent on the areas in which nurses are working, and are convinced that it's related to the lack of supply of PPE. We actually do also have a fund that ICN established, and people have been donating to that, and we have been using that to help with the support of personal protective equipment. We will have a call to action coming out in just a few days. We wanted to hear from you on these webinars to finalize that, but to make it very, very clear what needs to be done to look after and protect our nurses and all healthcare workers. I spoke to the president in Zimbabwe just yesterday of our association, not the president of our association as well, and that's an extremely worrying situation. I know WHO colleagues will talk about their guidance. Our learning, the videos were up on our website, as the president has said, but also just to let you know that in the next day or two, with our partners at the World's Continuing Education Alliance, there is an app with learning materials for emergency response, which will be being launched as well. We also have work with other key partners in the pipeline, something from us and ICRC next week. And we will, of course, be sharing all of that and everything from these webinars with you all over the coming days. I'm now going to move, Elizabeth, to you. I know that you've been absolutely at the centre of WHO's efforts, and we're very grateful for your time to hear about your work and perspective. Elizabeth.
Thank you, Howard. Thank you, Annette, and thank you for the invitation to be a part of this webinar. As Annette said last year, when the World Health Assembly designated 2020 as the International Year of the Nurse and the Midwife, in recognition of the vital role and contributions of nurses and midwives to universal health coverage, that decision effectively had the spotlight on nurses and midwives. But as we've seen very recently, COVID-19 has again put that spotlight on nurses and midwives globally. Now, this was a great opportunity to leverage for greater investment in nurses and midwives and realize what more we could achieve and contribute to universal health coverage and the SDGs. The global nursing and midwifery workforce were mobilized with exciting plans for the year and beyond 2020, and with a call to a decade of action for nurses and midwives. The Year of the Nurse and Midwives was also the opportunity that we looked to leverage, one, to strengthen nursing leadership and influence policy decisions, and two, for more investment to address the 9 million shortage of nursing and midwifery staff and invest in education, regulations, and improved employment conditions. It also was the opportunity for advanced nursing practice and advocate for more nurse and midwife-led clinics and practicing to the full scope of their license. And the fourth on that agenda was for gender equality. And it was anticipated that this would be supported by data and evidence from the first State of the World's Nursing Report to be launched on the 7th of April on World Health Day. And countries would be supported to influence policy decisions as per their context and priorities. Now, these plans are still in place, but due to the outbreak of COVID-19, we are reframing how we take forward these plans. As the COVID-19 crisis have evolved, we have witnessed nurses and midwives courageously, as Annette referred, stepping up alongside their co-workers to care for patients with compassion and commitment. And as we've seen, working tirelessly and selflessly to make sure patients are cared for during this crisis. What is interesting to note, though, is that the agenda we have for the Year of the Nurse and the Midwife are relevant and currently is implicating our nurses and midwives in this COVID-19 pandemic. I am deeply saddened when I get emails with told stories and see videos about those that have been infected and those that have died in the line of duty. We do not have yet any accurate data on the number of healthcare providers, especially nurses and midwives, who have been infected or have died as a result of COVID-19. Although we are seeing countries and hospitals releasing some data on this. Understanding that gathering data during emergencies is often quite difficult, and until a few weeks ago, gathering data regarding health workers specifically was quite low on the radar. We recognize the importance, especially of knowing about infections and fatalities and gender, not only for future studies and public information purposes, but also to detect gaps in training or equipment where health workers are not only victims, but vectors for infection, and where those factors can be mitigated, and especially on issues related to worker protection and decent work, with efforts to provide focused support to regions and countries, especially where low resource environments require adapting approaches. My colleague, Catherine Kane, who is the focal point at WHO on occupational health and safety, can elaborate more on this ongoing work. I also understand my colleague, Professor Benedetta Agranzi, is also available on the panel to provide some expert advice in regards and guidance in regards to IPC, and as part of the response team to COVID-19 may add additional information as may be needed during this webinar. WHO have been working in collaboration with key nursing and midwifery partners, ICN, ICM, Nursing Now, and UNFPA, to maximize on the significance of the Year of the Nurse and Midwife, to leverage what more could be achieved, and especially during this COVID-19 crisis. The WHO Director General, Dr. Tedros, is chairing this high-level steering committee made up of leaders from these organizations, including, of course, President Annette Kennedy of ICN. Just yesterday, I had an email, I had an internal WHO all-staff virtual seminar to reorientate everyone to the Year of the Nurse and the Midwife with focus on implications of COVID-19 on nurses and midwives, and invited nursing and midwifery colleagues working in country offices at NHQ to hear their perspectives and work that they are doing. So it is really important during these difficult times that we continue to reach out to each other for support, to share experiences and learn from each other. So thank you, Howard. Thank you, Annette, for your continuing engagement to support nurses and midwives everywhere. Thank you all.
Elizabeth, thank you so much for that. The issue of infections in data is one that we've been talking about and pushing, and we all know the significance of, and it's clearly a priority area. In addition to the infection rates, we know tragically so far ICN has received reports of 10 nurses who have died as a result of contracting coronavirus, and as tragically, just yesterday there was a report of a nurse who had committed suicide, which was reported was as a result of the pressures that she was under, and it raises an equally important issue in terms of the physical aspects of this virus, but the psychological and the mental health issues and implications of which there is WHO guidance, and you will see that ICN is absolutely making sure that those issues are dealt with equally in everything that we are doing. Both need to be considered extremely seriously. Elizabeth, you talked about PPE, and I'm going to come to Catherine, and I'm going to come to Benedetta as well just now, because we know that the supply of PPE is a major issue, but also the distribution and issues in terms of whether countries are abiding by WHO recommendations on PPE. So, Catherine, Benedetta, we know that you are very much the engine room on these issues at WHO. Thank you both for your time, and I will now hand over to you.
Hi, Howard, thanks so much. And I'm coming from the health workforce perspective. So what I'd like to do is give you a quick overview with which Howard is extraordinarily well informed as someone who's been in touch daily talking about the health workforce implications of this. So I'm going to go through a little bit of the work that we've been doing, what we're looking at, and what we're planning. I was reminded, in fact, 1 or 2 days ago, of a picture I'd taken a couple of years ago when I was working with the Red Cross. And it's the creed of the Red Cross nurse, and it says, "Wherever disaster calls, there I shall go. I ask not for whom, but only where I'm needed." I think that reflects very well the spirit and the willingness that I see, particularly in the nursing profession. One of the first documents that we were working on with regard to guidance for the COVID-19 outbreak was the rights, roles, and responsibilities of health workers, including occupational health and safety. That was developed and issued in January, and now is accompanied by a health worker risk exposure assessment tool and data set. These were some of the first issues that we raised with the Health Emergencies Department, and we have been in discussions on an extraordinarily regular basis, as Benedetta will reflect for you, on those issues of worker health and safety, as well as on issues of how to optimize distribution and roles of health workers during this. We have been hosting a series of calls with the WHO Information Network for Epidemics. For healthcare professional associations, Howard was probably the first person to jump on for ICN, along with a number of other very important professional associations and collaborating centers. In these weekly webinars, we share situations and then do focus areas, including occupational safety and health, mental health, psychosocial first aid, resilience, lessons from the field, physical distancing, and we continue to roll out these webinars as an opportunity not only to share guidance from WHO, but to understand from healthcare professional associations what they're hearing from the field, what the experiences are, what the needs are. We are developing materials currently with regard to health services delivery during COVID-19, and their products focus both on maintaining essential health services and on the response specifically. These include a health workforce modeling tool, which dramatically illustrates the shortages we have, particularly of health personnel who are able to deal with the approximately 20%, and some of you know the numbers even better than I do, but of the individuals who will need hospitalization versus those with mild illness who may or may not be in congregate care facilities or at home. It's of note that WHO is framing preparation and response activities in terms of 4 C's: no cases, sporadic cases, clusters of cases, and community transmission. At this point, we're almost beyond the point where we worry even about that, but for some countries, it's really important still to look at some of those activities and to design systems accordingly. Some of those materials are going to be released early next week, including the health worker modeling tool, and that will expose what we already know, which is the need to scale up dramatically essential health personnel, which of course is heavily composed of nurses as half of the world's global workforce. And this includes especially specialist nurses, which are highly in demand for those who are in intensive care units. As we scale up essential health personnel, we have to ensure that appropriate refresher training is available. We have to look at wise decisions with regard to the skills mix of teams, with maybe one very experienced specialist nurse and others who either have generalized skill sets or who are newer to the profession, working in teams so that we use resources best. When we look at recently graduated students, we know that a number of countries are looking at accelerating programs, and we advise that this is looked at in a very measured way, because it is quite important that individuals and students are available to complete their training. It's also important for recently graduated students to, one, ensure that they are willing to work in the COVID environment, to ensure that they are appropriately trained and supervised and protected, and that they have tasks that are appropriate to their knowledge, skills, and experience. We think that overall it's quite important that appropriate management and supervision is available at all levels, something that the nursing profession does quite well. And then also, as we're looking at scaling up essential personnel, we're looking at options like reserve corps, military medical services, and those repurposed from less affected areas, as we'll already hear. One of the recommendations that we are looking at with regard to occupational safety and health is ensuring that working hours are scaled appropriately and shifts are designed to avoid fatigue and burnout, as well that mental health resources and stress counseling and other support resources are available through management in an environment that welcomes workers' concerns and seeks to deal with them rather than stigmatizing workers who may raise their hand and address those concerns. We are also working on an innovative delivery of pull information right now through the newly not even launched WHO Academy. We're trying to consolidate all of the materials that are currently available through WHO and put those in an app, because surveys have found and evidence shows that workers need not to go hunting through a website, but to have information that's available on their fingertips in the ways that they are most familiar. And that, of course, includes through their smartphones and apps. The design will have its first iteration next week. This is a rapid scale-up design that's happening over the course of, in this case, not even 2 weeks yet. And we're looking to deliver online learning experiences, including workshops, including already designed training like the WHO, like the GOARN training delivery, like workshops for health workers who need them. We are prioritizing those training areas that have been identified through a survey that we are doing, to which many of you probably already have responded, that asks what priorities are, what modalities are best for delivery of training, and what is needed first. So we are expecting to roll out some of those online features, first with the information next week, next with the virtual classrooms coming shortly. And then we're also looking at developing an opportunity where people can ask, where health workers, nurses can ask questions specific to COVID-19. And we're working with a network of experts who will be able to answer those and start to build a knowledge base that can be easily searched. And when the question has not been answered, that it can be, and eventually to look at, and when I say eventually, I'm not saying 3 months, 10 months from now, I'm talking about as soon as possible, to create an opportunity for those in less affected areas to offer information, advice, and mentoring, as well as those whose epidemic curve is starting to slow. As we're talking about that epidemic curve, which Elizabeth referred to, we know that it is critical that WHO is not a voice in the wilderness calling for rational, effective social distancing, testing, and staying at home. And I wanted to say that we really appreciate ICN's partnership with regard to these efforts in carrying messaging to communities. So while it is wonderful to see clapping, in my city, we actually clap every night at 9 o'clock. And it is, in fact, probably part of psychosocial support for non-impacted people, this clapping for health workers and coming out in community. But we need to go beyond clapping. And as we saw in one Chinese city yesterday or the day before, whole sets of communities coming out to cheer for workers who are leaving. We want to see more communities coming out to cheer for workers who are leaving, because that epidemic curve is going down. And that can be accomplished by asking the public to help us and by health workers' concerted efforts to contain this illness and address the needs of those who are most vulnerable. We are also looking from the standpoint of health workforce at gender considerations, at expectations that are balanced between home and workplace. And we are working with ICN and other organizations to ensure that we're addressing those wider scale issues that make it more conducive for health workers to do their jobs and stay in their jobs and to be appropriately recognized. I was talking with labor unions yesterday, and they raised the point that now more than ever, we have the basis of information to talk about why we should be valuing care professions, investing in building more health workers, because this situation only more dramatically highlights that gap in health workers, 9 million gap in nurses needed globally that we have and are trying to address through the Year of the Nurse and the Midwife and the decade of action to which you've committed. And then lastly, we just cannot afford attrition. We cannot afford burnout. We cannot afford unnecessary deaths or any deaths of our health workers, of our nurses. So we will work with you to find appropriate ways to ensure or to help. I'm going to offer you my colleague, Bernadette, who can address from the World Health Organization Health Emergencies Department what is being done to address the occupational and safety and health within infection prevention and control.
Catherine, thank you very much. That was a very comprehensive, incredibly comprehensive run through. We're at 10:20. We started late. I'm going to run to 11:45. Benedetta, definitely going to come to you now. If you're able to be reasonably concise, that would be helpful. And I do know that a number of the questions that have come in have been in relation to the use of PPE, and particularly WHO guidance around which masks to use in which settings. Benedetta, to you.
Thank you, everyone. Thank you, colleagues who have spoken before me. And indeed, I don't think I need to repeat anything because it has been a very, very comprehensive and detailed overview of the problem. I'd only like to add 2 or 3 things. First of all, talking about the problem of healthcare workers' infections. I think that we need to be aware that this is a very, very relevant problem, but also we need to be able to look at its complexity. And indeed, I think it needs to be understood carefully and in a comprehensive way. I think that nowadays we have 2 very important aspects to look at. One is data and what are the actual data. We believe there is probably underreporting. The problem might be even much bigger. And I think that it's very important that countries really pay attention to this aspect and we all together improve data collection on this problem. The second point of better understanding the problem from the IPC perspective, I think we need not to forget the learning and understanding we gathered from previous outbreaks. In particular, I'm thinking of the SARS and MERS outbreaks, but also the Ebola outbreak. The issues that pertain to the causing of healthcare workers' infections are always very similar in each outbreak. And I really would like to point out that we know this is due to multiple factors that our colleagues already pointed out. But from the IPC perspective, I would like to remind the fact that protection is one part of the problem. So for sure, these days, we have the acute issue of PPE availability that needs to be addressed very seriously. But there are other aspects. PPE and protection for healthcare workers is not the only factor that leads to exposure to risk. There are also environmental controls that pertain to other aspects. Very simply, especially low-middle income countries, limited hand hygiene facilities, for instance. We know that hand hygiene is the other primary measure to prevent transmission. So these environmental controls infrastructure issues are very important as well. The second set of aspects are IPC practices. We know that there are limitations and there is limited compliance and very scattered depending on countries and settings about IPC standards. And this is also sometimes due to, again, lack of sufficient education and lack of sufficient infrastructure and protection. So this is another aspect where other colleagues have pointed out. It is extremely important at this point in time to strengthen education and reiterate the key principles of IPC and of use of PPE, for instance. The last point, which is extremely important and has been highlighted already, is the staffing level. I would like to remind everyone that in our main document and guideline produced in normal times, not for this outbreak, but which highlights what are the core components of IPC programs and what are the effective ways of implementing IPC. We have one strong recommendation on staffing levels because it has been already recognized by many studies that outbreaks are correlated to low staffing levels. So there is a recommendation there already since some time, and we need to pay attention to this aspect as one of the determining factors, together with staff pressure and staff well-being, which is clearly not maintained at this point in time. So this was my first point and very important point. I then want to conclude that I'm happy to answer any question related to specific IPC guidance developed by WHO. I would like to highlight that we have made available a range of guidance documents and also supports such as online training. And all of this is based on consultation with nowadays more than 100 experts worldwide in different disciplines to whom we talk every week. We have every week at least one call to continue to fine-tune and confirm or review our guidance. So I'm very proud of this and of the collaborations both within WHO and also outside WHO in developing this guidance, and I'm very happy to answer any question.
Benedetta, thank you so much for that. We are getting lots and lots of questions in. We're not going to have time to be able to deal with all of them now, but I will say to colleagues that we will collect a number of these questions. We'll look at them, put them together. We'll talk to WHO colleagues about coming back to you. One of the key themes that's clearly coming through, and I'll mention this because our colleagues from the associations from Taiwan, China and Korea may have views on this as well, that the evidence clearly points to droplet transmission, but it's not definitive. And of course, people are asking whether WHO should be recommending the M95 or the FFP2 masks as a minimum. So that's clearly an issue which is coming through that we need to do some follow up on now. But I'm going to firstly go to Dr. Wang, the president from our association, the Taiwanese Nurses Association. Dr. Wang, over to you.
Thank you, Howard. Hello, everyone. This is Xiaohong Wang, President of Taiwan Nurses Association. I'm honored to share Taiwan experience to combat COVID-19. This chart shows the trend of COVID-19 situation in Taiwan. I just highlight some important measures and policies. On January 15, the COVID-19 was added in the list of notifiable infectious disease. January 20, the Central Epidemic Command Center was quickly activated. January 24, the mask export was prohibited. On February 6, the name-based rationing system for face masks was established. February 24, home quarantine trace system by app was set up. February 25, the special statute for prevention, relief, and restoration was passed. On March 7, hazard subsidy was approved with $330 for a nurse per shift. In Taiwan, National Health Insurance System was inaugurated in 1995, which provides universal health coverage with a rate of 99.9% and provides accessible health services to all citizens. After SARS, Taiwan established Communicable Disease Control Medical Network and has been on constant alert and ready to act on epidemics. 6 sub-regions were set up, including 134 isolation hospitals and 1,100 negative pressure isolation rooms to provide care for patients with communicable diseases. The CCC is to implement case identification, containment, and resources reallocation. It hosts daily press conference to update information and policy. All television channels are being used to provide a variety of public educations. Clear SOPs and policies for home isolation, home quarantine, and self-health management were announced. Effective communication and transparent information raise people's consciousness and prevent panic. The CECC and hospitals are based on medical and travel histories to identify people who are at risk. App and AI, including QR code and online reporting, were used to classify people's travel history in the past 14 days. And clinical symptoms help identify the cases. Hand sanitizer and temperature check have become a routine in every public spot. The test of coronavirus are free for the public. As early as January 24, resources allocation was controlled and monitored by the government, including proactively deploying 3 million N95 masks and 3 million isolation gowns on a 35-day safety stock. Manufacturing companies set up more machines to produce masks, prohibit mask export, set reasonable price of masks, allocate government funds, and assign military personnel to increase mask production. Mask sale through website or pharmacies adopting name-based rationing system. The role of Taiwan Nurses Association in this situation, including speak for nurses to ensure sufficient PPE and equal subsidy. Hazard subsidy for nurses has been approved by the government. Endeavors on media to raise public awareness and the nurses' profile, such as sharing stories, photos, and videos. Call for termination or postponement of last long and large-scale activities and the best use of technologies in meetings, workshops, and seminars. In conclusion, in Taiwan, the quick response and high vigilance of CECC and the cross-departmental collaboration are the key to contain COVID-19. The Taiwan government, healthcare systems, and the public work collectively to combat this pandemic. We are nurses. We are so proud to protect global health. Together, we can win the battle against the unseen enemy. Thank you very much.
Dr. Wang, thank you so much for an excellent overview and insights into your experiences. Colleagues, all of these presentations will be available afterwards. We're also going to make the recording of this webinar available as well. Now I'm going to move to Dr. Wu, the president of the Chinese Nursing Association. Dr. Wu.
Hello, everybody. Good morning.
Dr. Wu, we have an issue with the sound. We can't hear you. There's a distortion with the sound. I don't know if you can move a little closer to the microphone, perhaps. Sorry, Dr. Wu. I'm sorry. It's very. We can't hear you. There's a distortion. Dr. Shin, I'm going to move to Dr. Shin. We still have a problem with the sound from Dr. Wu. Dr. Wu, if you can hold, we'll see if we can improve your sound. Dr. Shin, can I come to you, please, from the Korean Nurses Association? Dr. Shin. Dr. Shin to you. Dr. Wu, if you can just mute for a minute, please, that would be great. Dr. Shin to you.
Okay, hello everyone. I am very grateful to ICN for organizing this webinar. In the Republic of Korea, the first confirmed case was reported on January 20. And in February, the number of infected increased immensely by more than 500 per day. However, the number has slowed significantly since mid-March, thanks to the swift efforts by our government and public support. Now, the condition is well managed, with the number of infected people reported around 100 daily. According to the data, as of today, around 377,000 people were tested, among which 9,300 confirmed at the rate of 2.5%. That rate is 1.45% with a total of 134. The government is carrying out daily media briefing in an effort to build public trust and maintain cooperative system through emergency system. Korean Nurses Association established an emergency committee within the association. Learning from the past matters experience, we tried to serve as a channel in terms of the shortage of workforce supplies and the working condition for the frontline nurses. Initially, we had difficulty securing the required amount of equipment, including masks, level D personal protective PAPR. We are continuing close dialogue with the government and affiliated provincial nursing associations. I visited the sites and made commitment to make sure that the distribution of appropriate supplies is properly arranged to the designated medical institutions and nurses in the front line. Korean Nurses Association is in close contact with the COVID National Emergency Response Management Center. We discussed on the frontline health professionals' compensation arrangement and to promote well-being of the nurses. Until now, over 3,600 nurses have volunteered as part of supporting the government. KNA recruited volunteers through our official website and sent the list to the government. There has been a tremendous participation from experienced nurses in emergency room, medical surgical units who sacrificed their vacation, as well as retired nurses and newly licensed young nurses. We are very grateful for their service. KNA also distributed additional masks, hydrocolloid dressings caused by wearing masks for long hours. In addition, nurses are constantly in alert, caring for high-risk patients. So there is an increase in number of nurses reporting high level of psychological stress. Hospitals are taking action, such as facilitating work hours and allowing more break time. KNA has set up counseling hotline to provide psychological assistance for the frontline nurses. Now, KNA is currently focusing on preparing for the replacement of long-hour working nurses and adequate compensation for nurses who are employed by hospitals. To prepare a long-term measures appealing to the government and the political community, Korean Nurses Association is actively engaging with both domestic and foreign mass media to induce public opinion. In addition, KNA is putting much effort to improve public awareness through campaign on infection prevention, as well as distribution of masks to vulnerable groups at the community level. Through our experience of this outbreak, we were able to make recognition of nurses as a medical professional playing an important role. Frontline nurses fighting COVID have been broadcasted every day and were published on major newspapers, where images such as sleeping in poor environment, having scars and bandages all over their faces due to wearing PPE. This has been touching people's heart, sending letters of encouragement. In response to the public, some nurses working in the front line have been nominated as proportional representation candidates for the upcoming general election in April. Their placement in the National Assembly will enhance preparation for nursing legislation and policies. Thank you once again for giving us the opportunity to share the current situation in Korea and KNA's response to this crisis. Finally, I would like to point out the exemplary lives of Marian and Margarita, whom we nominated for the Nobel Peace Prize. Thank you very much. Thank you.
Thank you, Dr. Shin, again for an incredible overview of all of the work and yours and your association's phenomenal leadership. Dr. Wu, we've tried to reconnect you to try and improve the line. So, Dr. Wu, the president of the Chinese Nursing Association, I'm going to come to you now. Dr. Wu, can you hear us?
Yeah. Yes, yeah. We can.
Okay,
They can.
Go ahead, please. Go ahead.
Okay.
Dr. Wu, I'm really sorry, but we can't hear you here. What we will do is that what's been clear from this morning's webinar is that we've been overrun with questions. Clearly, we have another webinar this afternoon, but we will will undoubtedly be organising more webinars to share experience from the associations. Let me try one last time, Dr. Wu, but if we can't hear you, I'll move on, but we will find another way for you to share your experiences. Dr. Wu, back to you.
Can you hear us? How?
It's very poor, Dr. Wu. Yeah. No, Dr. Wu, I'm sorry. It's distorted. People won't be able to hear. I'm gonna, as I said, we will share the presentation. We will organise another occasion to make sure that we hear from the Chinese Nursing Association, because your experience is going to be is clearly so critical to learning right the way around the world. I'm very, very sorry, but we will make sure that we find a way for the Chinese Nurses Association for their experience to be shared. Colleagues, we are now at time. As I've said, there is a webinar this afternoon where we hope that our Spanish, Italian and Swiss associations will be joining and sharing their experience. I'm going to go to our president in just a moment for a final word. My sincerest thanks to everyone for joining and for all of the presenters. Two issues just to make sure that you have got on your radar, colleagues. Next week, we will be releasing this year's International Nurses Day resources. We always release them a little bit before the 12th of May so that you can use them in your planning and your preparations for the 12th of May. This year's report and resources, Nurses: A Voice to Lead, Nursing the World to Health, couldn't be more aptly named. So please watch out for those coming out next week. And then the following week, the State of the World's Nursing, the first ever report, WHO, ICN Nursing Now. Again, even more important than ever that the evidence from that report, the recommendations from that report, that everybody is aware of them and takes them and uses them and acts on them. So the next 2 weeks, the International Nurses Day resources and the State of the World's Nursing. Annette, I'm going to come back to you for a final word, Annette.
Thank you, Howard. Can you hear me? Howard?
Yes, we can. Yes,
okay,
we can.
That's good. Anyway, thank you to the panel, to WHO, and to our guests from the NNAs, Dr. Wang, Dr. Shin, and Dr. Wu. I'm looking at some of the text coming in, and it's obvious that what is so important to our colleagues out there who are listening is the information from the NNAs who've had the experience. Let me tell you that we will get the information out to you, we will get the slides out to you, and we will answer your queries. What we would like very much to hear from you is your comments on this web conference or the webinar, and to hear any questions that you have to ask. And also, we would like to hear from you information that you can share and we can share with other NNAs. But obviously, the most important thing to you is to hear from the associations who have been through it and who have experiences to share with you. I'm sorry that it went on too long. I'm sorry that we had some problems with our technology, but that's the way life is. Without further ado, I just want to thank you all for all the work you're doing. It's extraordinary times and extraordinary work that nurses are doing all over the world. And all we want to do is to support you, keep you safe, and make sure that no more people die, either nurses or our general community. Thank you for today.
And Annette, thank you very much. If any of you want to join us this afternoon at 3 o'clock Central Eastern Time, Central European Time, sorry, for the second webinar today, we will be doing further webinars. We will be doing a webinar to bring the Chinese experience. We are also talking to colleagues in Africa to have a webinar and sharing for them. Thank you, everybody. everybody for today. Thank you for your patience, your forbearing. Please take care of yourselves, take care of each other, and stay in touch with us and with your colleagues in the associations. Thank you, everyone, and goodbye.